Hello friends, my name is Ankit. I make educational videos on US healthcare and especially on FHIR interoperability trends. I'm back with another video on FHIR and its impact on HEDIS reporting. If you are new to my channel, welcome. If you are regular on my channel, I would like to thank you for your patronage. Please like and subscribe to my channel for future updates. Let's talk about HEDIS. What is HEDIS? The Healthcare Effective Data and Information Set, also known as HEDIS, is a tool used by more than 90% of the US health plans to measure performance on important dimensions of care and service. More than 190 million people are enrolled in health plans that report quality results using HEDIS in the United States. Since 2008, HEDIS has been available for use by medical providers and practices. Because so many health plans use HEDIS and because the measures are so specifically defined, HEDIS can be used to make comparison among plans. To ensure that HEDIS stays current, the National Quality for Committee for Quality Assurance (NCQA) has established a process to evolve the measurement each year, and usually the HEDIS reporting is due by July of each year for all of these health plans. What is HEDIS measures content? HEDIS measures address a range of health issues, including asthma medication use, persistence of beta blocker treatment after a heart attack, controlling high blood pressure, comprehensive diabetes care, and so many. So basically, there are so many parameters to report, and there are different measures that needs to be reported. For reporting, NCQA collects the HEDIS survey data directly from the health plan and preferred provider organization, also known as PPOs, through the healthcare organization questionnaire and collects non-survey data through the interactive data submission system, which is a proprietary tool from NCQA. The submission formats are defined for each type of health plan, for example, commercial, Medicare, and Medicaid, and data provider group. Schedules for data submission, analysis, and health plan rating releases are available on the HEDIS website. Now we'll talk about one specific HEDIS quality measure example. This measure is designed for weight assessment and counseling for nutrition and physical activity for children and adolescents, also known as WCC. It assesses children and adolescents 3 to 17 years of age who had an outpatient visit with a primary care practitioner or OBGYN during the measurement year and had evidences of body mass index, percentile documentation, counseling for nutrition, counseling for physical activity. Because BMI norms for youth vary with age and gender, this measure evaluates whether BMI percentile is assessed rather than an absolute BMI value. Why it matters? Over the last 3 decades, childhood obesity has more than doubled in children and tripled in adults. It is the primary health concern among parents in the United States, topping drug abuse and smoking. Children obesity has both immediate and long-term effects on health and well-being. Health lifestyle habits, including healthy eating and physical activity, can lower the risk of becoming obese and developing related diseases. Obesity can become a lifestyle health issue. Therefore, it is important to monitor weight problems in children and adults and provide guidance for maintaining a healthy weight and lifestyle. If you look at the HEDIS measure data, which is collected for BMI percentile assessment for 3 to 17 years age group, the percentage of measures, the quality of measures has improved. So if you look at data from 2009 to 2021 across the board, whether we are talking about commercial HMO, commercial PPO, or Medicaid HMO organizations, the measure reporting percentages has increased from 35.4% to 72.1% for commercial HMO, and similarly across the board for other type of plans. What it helps is it helps the health plan and providers to come up with some preventative measures and counseling. So if we move on to the next slide, this is the reflection of the improvement in the counseling, how it impacts the health outcome for these young adults. So from year 2009 to 2021, if we have a look at for the commercial PPO, the initial preventative screening score was just 20.3%. By 2021, it has improved to 55%. So we are seeing a significant increase in the communication between the provider and the patient, as well as the result it is taking in providing the improved care, preventative care to these patients, resulting in improved health outcome and probably reducing the obesity problem in these young people. Now, these HEDIS measures, they impact the health plan ratings. NCQA's health plan report card, it lists the commercial, Medicare, Medicaid, and exchange health plans. Commercial, Medicare, and Medicaid plans are rated based on their combined HEDIS and CAHPS scores and NCQA accreditation status. NCQA evaluates health plans on the quality of care patients receive, how happy patients are with their care, and health plan efforts to keep improving. This is one of the example of the health plan rating report card from NCQA. So once the health plans, they submit the data through the HEDIS reporting tool, as well as the data is collected through surveys. NCQA has its own way of performing the quality scores. This is one of the example where I selected the health plans for the state of California, and this is some random score that is shown on the NCQA website. For example, Aetna Better Health of California, it is showing as 2.5 star rating based on the defined HEDIS quality measures. Aetna Better Health of California Inc. This is a separate entity. They are showing 3 stars. So the different health plans, they will have different rating. This will also be helpful for the members to identify which plan they want to enroll with, and also basically it encourages the health plan and providers to continue to push for improved health outcomes when it comes to providing care to the patients. Now, what is future of HEDIS? NCQA has defined 5 core topics for defining the future of HEDIS, which includes flexibility, accuracy, ease, insight, and time. Talking about each of these measures, the first one, allowable adjustment. So measures are used for flexible purposes. To give you flexibility to do that, NCQA will tell you what those allowable adjustments are. Licensing and certification. Then NCQA will make sure uses of our measures are accurate and reflect the quality of the care the providers provide. Digital measures. We will start with giving you measures in a digital format that's easier to work with. Electronic clinical data system. A new reporting method helps clinical data creates insight. Schedule changes. We will do whatever it takes to give you more time each year to report your data. So why the use of FHIR? There is a paradigm shift in healthcare IT. In the past, we used to work with desktop PCs, static software, organization records, on-prem server, monolithic data silos, and static reporting. The future entails use of mobile devices, web-based application and apps, longitudinal health record, cloud, open APIs, flexible analytics featuring big data and machine learning. So there are more and more health plans that are focused on providing members access to their data in FHIR. There are other areas that HL7 International is focusing on where the data will be interoperable between various healthcare entities, whether it's peer-to-peer exchange where the members' healthcare data can be pulled from the previous pair into a central repository in FHIR format, or initiatives like patient cost transparency, electronic health, electronic prior authorization, and few other initiatives. So all of these initiatives are focusing on reporting of data in FHIR interoperable format. With the use of FHIR, if we can utilize that for reporting as well as for analytics purpose, that is going to transform the healthcare industry in years to come. So that's why there is more emphasis on use of FHIR for HEDIS reporting as well. Now, if we look at the current architecture for HEDIS reporting, in the current architecture, we use health quality measure format for metadata and population structure, clinical query language for expression logic, and quality data model, also known as QDM, as a data model behind the current HEDIS structure. When we start implementing FHIR for HEDIS reporting, so we'll be using FHIR measure report, which includes meta measure, data, population, structure, etc. We'll still keep using the SQL, which will be tied closely with FHIR. and we'll be using FHIR-R4 as a data model. As a lot of you may be aware, currently HL7 is focusing on releasing FHIR-R5, but still FHIR-R4 is actively used across the different stakeholders. So this is going to be the base on which these HEDIS reporting will be based on for FHIR infrastructure. Now, the NCK vision for quality measurement is to ensure that there are new data sources and improved content and flow, which includes the standardized electronic data, standardized machine readable logic in the SQL format. Measures should move beyond visit counts and low bar processes. It should be meaningful, patient centric. Uh, Programs use better measures harmonization across programs, and finally leading to the better accountability at all levels. One of the guiding principles for using the FHIR strategy for NCQA is to meet the stakeholders where they are, monitor the development, alignment across measurement programs, and send a signal. Send a signal to the industry, to the broader audience that these measures are working. We have a way to improve the HEDIS reporting, resulting into improved health outcomes. Finally, trial use of FHIR measures. So NCK is focused on release of a small subset of HEDIS quality measures specified as FHIR SQL for trial use. Providing a sample of what HEDIS digital measures will look like once the conversion to FHIR is complete, and providing an early preview of HEDIS on FHIR HEDIS to stakeholder website. So we have used most of the content from NCQA's own website. For more details, please feel free to visit NCQA's website. Rest assured, the industry is focused more and more day by day on use of FHIR and spread the FHIR interoperability across the industry for its downstream uses, whether it is HEDIS reporting for quality measures, preventative care for the patients, or improving the health outcome for broader audience. That's it for today. I will look forward to meet you for my next video. Until then, have a good day. Thank you very much.